Hey, I want to talk to you guys real quick about push dose epinephrine. So push dose epinephrine is at the concentration of 1 to 100,000, which is really diluted epinephrine. You might remember in anaphylaxis, we deliver epinephrine at a concentration of 1 to 1,000, and in cardiac arrest, it's 1 to 10,000 solution. So the easiest way to make push dose epinephrine is starting with cardiac epinephrine. This is your 1 to 10,000 solution, and you'll see on the box that it says that it has 1 milligram for every 10 mLs. That's going to effectively give you 0.1 milligrams per milliliter. So all we really need to make that is this concentration, a syringe or a flush with 10 mLs of fluid. Um, Now, when you get a 10 ml flush, you're going to have to waste 1 ml of it. That's going to give you 9 mLs of saline in this. If you just have a syringe, you can draw up saline out of a bag, draw up 9 milliliters of it. And you may be asking why, and we're going to kind of get into that. The third piece of equipment you need, and it makes it so much easier if you have, is this three-way stopcock. There are a few different ports on it. There's 1, 2, 3. The third one would lure lock into like an IV or something like that. But in this instance, we're going to use this to not deliver the medication, but to mix the medication so that we're kind of doing it with a needleless system, which makes it a lot safer for the provider. Uh, so first step, get your three-way stopcock out and make sure that it's out of its packaging. You're going to clean the ports on it with rubbing alcohol. Then you're going to take your introducer and your medication. You're going to remove the vials, remove the caps. Now everything's in its packaging. You'll verify that there's 10 mLs of fluid in this. Also, verify that it's 1 to 10,000 concentration of epinephrine so that you know that you for sure have the correct medication. And then we're just going to remove that cap and place it right here on this three-way stopcock. Pay close attention that the off position is what would be going to the patient or the male port of the three-way stopcock. There'll be 2 female ports and 1 male port. We want to make sure that it says off going here because we're going to use this other female port with our lure lock system to mix the medication appropriately. The next thing you're going to do is you're going to either get your flush or your syringe. Make sure that you have 9 mils of fluid in it. This one has 10 because it's a saline flush. So I'm just going to waste a mil of fluid out. I'll just waste that into my box here. There we go. 9 mLs of fluid. Then we're just going to screw that onto the other end of this three-way stopcock. And you can watch as you're doing this procedure, the ml hash marks on the side here. You're just going to push until you get 10 mLs of fluid in your syringe that has the normal saline in it. So now I have a total of 10 mLs of fluid in here. 1 milliliter of that is 1 to 10,000 concentration of epinephrine, and 9 is just normal saline. This concentration here will further dilute that by a factor of 10, giving us 1 to 100,000 concentration epinephrine, at least 10 milliliters of that. And what that is effectively every milliliter of this fluid has 10 micrograms of epinephrine in it. We're going to use push dose epinephrine when we're talking about patients who become hypotensive because they have a positive shock index, and we're doing rapid sequence induction, or sometimes we're doing this when we have patients who are septic or other reasons why they could be hypotensive and not responsive to some other treatment modality. It's as simple as that. Thank you for your time.